So we're going to talk about PCOS and inflammation because that word comes up a lot, but what does it actually mean? And it's a little bit confusing because I find that a lot of people culturally will use that word very casually to mean things like bloating or brain fog or joint aches. And so when we're talking about PCOS and inflammation, like what exactly are we talking about and in which way are we talking about it? Is it something you can actually measure, or is it just another wellness buzzword that gets tossed around? So we are going to sizzle down the inflammation because inflammation is a real thing in PCOS. It's not just a vibe, but it also doesn't mean what most people think it means. So hi everyone, I'm Dr. Mélanie DesChâtelets. I'm a licensed naturopathic doctor here in British Columbia, Canada. I know naturopathic doctors can do different things in different places, but in BC, that means I have my prescription right, so I can prescribe pharmaceuticals. I have full lab access, and obviously a deep passion for lifestyle and natural therapeutics. I've been in clinical practice for over a decade, since 2010, and I've helped over 1,000 people in the space. And so PCOS is a huge part of my work, and so I want to teach you some of the concepts that I see come up over and over in my practice. I'm also the founder of PCOS Shift Society, a community to help with PCOS IQ and accountability and just being surrounded by sweet things. So let's get started. Let's teach about inflammation. My job is to translate research into real-world strategy without telling you to eat like an influencer or give up your entire culture. So in this video, I'm going to help you finally understand what inflammation actually is, not just what it feels like, why people with PCOS might have higher inflammation, and what's the first step you should take to reduce it. Not with restriction or rigid rules, but with small, smart, sustainable changes. And we can get really practical on that. I'll also tell you how to join my free community at the end of this video. So let's get started. Okay, so what is inflammation? Let's start with what it's not. Inflammation isn't just like a feeling of like puffy or tired after a big meal or feeling bloated. It's not just a word to kind of describe something, even though that's very commonly done in our culture. When we're talking about inflammation and PCOS, we're talking about measuring certain things in lab work. It's a biological process. And when we compare this blood work, people with PCOS have more inflammation in their blood work than people without PCOS on average. Now, that doesn't mean that everyone with PCOS has inflammation. So inflammation is how your body responds to injury, infection, stress. And in some people, and sometimes we have like this really great big inflammatory event, but in other chronic conditions, we have kind of this low-grade inflammation. Sometimes it's not even at a level where it would be flagged on blood work, but it's still quite not as low as someone without PCOS. So the most common test that we'll see is called C-reactive protein, CRP. CRP in blood work doesn't tell us where it's coming from. It's just like a smoke detector. There's a signal, but we still have to figure out the source. So yes, it's real. When we talk about inflammation with PCOS, we're talking about being able to measure higher levels of inflammatory markers in the blood. So why does inflammation show up in PCOS? Here's what's interesting. Studies suggest that people with PCOS, even in smaller bodies, often have slightly higher levels of inflammatory markers like CRP than people without PCOS in a similar body size. It's not always dramatic, but it's there. And what's interesting is that there are other factors that impact inflammation, like body size. And I want you to think of inflammation as kind of like the base of your soup. it seems to like throw off a lot of other things too. And so we see this relationship with insulin resistance, high androgens, and things like that. Now, not everyone with PCOS has high inflammation, and high inflammation doesn't only happen in PCOS, but they often like to hang out together. And to be clear, I know I just called it high inflammation, but I want you to think about it as like a spectrum. There's like really high inflammation, and then there's just chronically low-grade inflammation, which is actually the kind of inflammation that we see more commonly with PCOS. But inflammation tends to, like I said, be kind of like the soup that messes up a lot of other hormone signaling, insulin sensitivity, and it just creates kind of havoc in the system. So how do we want to reduce inflammation? So first, I want to just call out something obvious, or not so obvious, to be fair. Obvious to me, but not obvious. It's that the term anti-inflammatory diet gets thrown out a lot. And for the most part, there's not really like a standardized definition of that. And so you might follow one follower who's like, this is the anti-inflammatory diet, and another follower, and that's the anti-inflammatory diet. Okay. Now, when we're looking at the research, there is a very specific universal definition, but it's based on a scoring sheet that you have to pay for to do. And so practical and research, really not helpful in day-to-day life. So then what are we going to do to kind of get on the same page in a more evidence-based way when it comes to inflammation? Now, there are a lot of different patterns in research that have shown to reduce inflammation, but those patterns have a lot more things in common than they do that differentiates it. So like the Mediterranean style diet, the DASH diet, and things like that. I'm going to focus on the Mediterranean diet because it's probably one of the ones that has the most research at decreasing levels of CRP in the blood work. When people move towards more of a Mediterranean style diet, then those markers improve. Now, at the base of it, it usually means like a higher fiber carbs in the diet, like beans, lentils, healthier fats, like olive oils, nuts, and fish, and less saturated fats, which are more pro-inflammatory, and a lot of really colorful produce. So we're going to go through the questionnaire together so that you can kind of rate your own diet against the Mediterranean diet. See where your wins are, celebrate those. Also see where your gaps are, and it might give you some really tangible steps that you can work on, and in a way that you know will improve your inflammation status. Okay, so I'm just moving screens here. This is the Mediterranean diet score tool, okay? And so let's do this together. And basically all I need you to know is that as you improve your score, you're decreasing your risk, okay? And higher score has also been associated with lower risk of cardiovascular disease and all-cause mortality. So, question number 1, is olive oil the main culinary fat used? Yes or no? 2, are greater than 4 tablespoons of olive oil used each day? Yes or no? 3, are greater than 2 servings of 200 gram each of vegetables eaten each day? Are greater than 3 servings of fruits eaten each day? 5, is less than 1 serving of red meat, hamburger, or other meat products eaten each day? 6, is there less than 1 serving of butter, margarine, or cream eaten each day? 7, is there less than 1 serving of sweet or sugar-sweetened carbonated beverage consumed each day? 8, I'm going to skip for right now. 9, are there greater than 3 servings of 150 grams of legumes consumed each week? 10, are there greater than 3 servings of fish or seafood eaten each week? 11, is there less than 3 servings of commercial sweet or pastries eaten each week? 12, is there greater than 1 serving of 30 grams of nuts consumed each week? 13, is chicken, turkey, or rabbit routinely eaten instead of veal, pork, hamburger, or sausage? And 14, are pasta, vegetable, or rice dishes flavored with garlic, tomato, leeks, or onions? And is that in the diet greater than twice a week? So tally the number of yeses. Now, I skipped number 8, are greater than 3 glasses of wine consumed each week. So yes, this form has been validated, but we now have newer research on alcohol, and we know that the risk of alcohol increases our risk of cancer. So this is something where if you are not a drinker or you are drinking less than this, I am not recommending that you start consuming alcohol because there are other risks associated with it. And I think that in future versions of this, we will see this question changed because the overall risk benefit ratio is definitely more towards causing harm than benefit for any kind of alcohol. Okay. So this is a very practical way for you to say yes or no. And in the ones that you said no, there are steps that you can take towards turning that no into yeses. And every time you do that, you will be decreasing your inflammation score and also your cardiovascular disease risk and your all-cause mortality. So really, a lot of research has been done on the Mediterranean diet. Now, just so you know, the PCOS guidelines don't talk about the Mediterranean diet. They talk about just general population-based guidelines. Like, in Canada, we have our Health Canada food recommendations. That being said, there's a lot more that overlaps with this than that differentiates it. And so I find this scoring tool can be just a very practical way to kind of understand a little bit the factors that play a huge role in inflammation. So lastly, should you test for CRP in the blood work? Let's talk labs. So the guidelines don't say that you have to test CRP if you have PCOS. So it's not what we would consider like standard of care. And it's not like a must need blood work. But I do have a bit of a nuanced take on it. People that come to see me tend to want to be a little bit more proactive about their health and kind of see like where they live among that spectrum. And so with some of the people that I work with, we will test it because it's relatively a very low cost test that might kind of give us some insight and might kind of give us some more objective data on how you specifically are responding to lifestyle changes or supplements or medication. So it's not a must-have, but in certain circumstances, it is something that can be, but at the end of the day, the reason it's not standard of care is that they would simply say, well, everybody should just shift their diet towards concepts that will reduce inflammation anyway. So what's the point? Okay. So inflammation, it's a real thing. We're talking about it in a very specific way. It's measurable if we do measure it in lab work, and it can be improved with the right tools. So if you want help putting what you're learning into action, come join us in the PCOS Shift Society. It's my community where you can pitch your top PCOS questions. You'll get accountability to do the thing, not just think about it or learn about it or consume about it. Do the thing, set it as a goal, and it's just a cozy spot. It's a soft sweater on a fall day. So come join us and have some of these conversations in our community. Have a great day.